Well, it may seem a little strange, but for some people with deafness in one ear, a new device called SoundBite uses their teeth to improve their hearing. Here to explain how it works is Dr. Gwen Kandula with the Hearing Center at Advent, along with Tianna, her patient who's been treated with this device. Welcome to the Morning Blend.
Thanks for having us.
This to me, it sounds like outer space. I mean, this is amazing. You can treat one ear, single ear deafness through a piece that goes in your teeth.
Absolutely.
What is single ear deafness?
So single ear deafness in the person we're looking for with this is somebody who has a good nerve on one side. So their nerve has got to be really good on one side, but the ear on the other side just isn't working the way it's supposed to.
What can cause it?
Oh, it can be caused by lots of different diseases and disorders, but as in Tianna's case, it can just happen sometimes and we don't know what causes it. And these are folks who really the hearing goes completely out and are essentially what they would consider being deaf on one side.
In your one ear, you lost hearing in your right ear about 4 years ago.
Correct.
Did you know right away that it was permanent? Were you thinking, oh, this will come back? What were your thoughts when it happened?
You know, I had no idea it was going to be permanent. I thought maybe it's an infection of some sort. So when I was told that I wouldn't be able to hear on my right ear again, you know, it was devastating.
Yeah, how did it change just your, because you're very young, you know, and a lot of people, when we think of hearing loss, we think either it happens when you're real young because of an infection, but not, you know, at your age, we don't think of it as often. So how did it change your daily interactions?
Yeah, you know, I got it in high school, so walking down a crowded, noisy hallway in high school and trying to have a conversation with my friend was, you know, nearly impossible. And I had to sit on certain sides of the classroom, and even just going to a movie, you know, I had to make sure no one was sitting on my deaf side.
Yeah, no secrets being told.
Exactly.
Right? Maybe that's good.
No. My friends would still tease me and do that.
That's the hard part, though, with a hearing loss that severe is when there's something going on your side that's deaf, you don't even know what happened.
Yeah.
You know, it's just gone and you didn't even have the chance to try to hear it. So,
I can imagine in situations where you're sitting in a row or sitting at a work and somebody works on either side of you, or you're at school, like you said, these kinds of things can truly be life-changing to not be able to hear in one ear.
Absolutely.
Exactly.
Yeah.
So how do you fix it? What do you do with single ear deafness?
Yep. So what we have is single ear deafness when you do have a nerve that's still really good. This is a device, I'll admit I was a little skeptical when we first looked at it, because as far as audiology and ENT goes, wearing your hearing aid in your mouth. I was like, really? Do they know we've
So it was
studied
new to
this?
you. You'd never heard of it either.
No, this is very new. But I've got a replica here of what it looks like.
We're
and
looking
if I
at it
just
right
open
now.
it up, so here's the mouth, and then if I open this up in the back right here, this piece is the retainer that she would wear in the mouth, and it has a real snug fit.
So it clips in.
It clips in.
There's no surgery.
Nope. And this piece right here would still be worn on her ear, and the sound then is transmitted from her ear to stimulate this piece, and it goes through the bone to stimulate the nerve.
See that? I mean, that to me, it's mind-blowing. But why do the teeth connect with the ear? I'm not quite getting that.
So your nerve of hearing is embedded back here in your mastoid bone, and it's the same bone your teeth come out of. So it's all connected there. So you can, even your forehead, if you stimulate that, you can get that heard down in your hearing nerve. So by us getting a real nice tight fit there on her teeth, that sound can just transduce right through her. And the great part is that it's really clear, it doesn't have distortion and things like that that we see with hearing loss when there's severe nerve damage. So they just turn it on basically and you can hear.
So what has it been like wearing it? And can you wear it all, do you wear it all day, and do you sleep with it?
I wear it all day, yes. Yep, it has an 8-hour battery life, so I have 2 of them I can switch out, and it's just been incredible. And the second they had me put it in, it worked immediately. And everything just sounded more clear, and I actually plugged up my left ear, my good ear, and for the first time in over 4 years, I was hearing out just my right ear. It was incredible.
It's really profound. It's that instant gratification that we don't get real often.
That's amazing. And do you eat with it too, or do you take it out when you eat?
Yes, I can eat with it. You know, if I go out to a restaurant, I'll keep it in. Sometimes if I'm just at home, I'll take it out just because it's easier.
I think it's amazing, and I can imagine how it changed, like, you know, being in school, spending time with your friends, spending time with your family. Did you notice instant improvements in those relationships and just in your schoolwork?
Yep, life became a lot less frustrating.
And it was nice. I felt really happy that Tianna was one of the first people that happened to come in just as we were getting going with this. And here she is, a sophomore in college, in a lot of those big classrooms where really students with hearing loss in one ear or any type of hearing loss really are kind of at a bit of a disadvantage from their normal hearing peers. So it was a really nice time to get her in and get her fit as she's working through college, and just to keep her, you know, up with the same opportunities all the other students are having. So
it's
amazing. Really great.
The things that you do for people with hearing and the way that you can change lives and communication is really wonderful. So for people who have single ear deafness or any hearing issues, or if someone you know is struggling with conversations or understanding or hearing you, contact the Hearing Center. They're located on Highway 100 and Watertown Plank Road in Tosa. The phone number on your screen to call for Dr. Gwen Kandula is 414-771-6780. It's a wonderful place, advent.md, to really change someone's life and communication style. Thanks for being here. SoundBite is what to ask for by name.
Thanks
so much. And congratulations to you.
Thank you so much.
Absolutely. And still